Hope that is fine, sir.
Hello guys, welcome to my YouTube channel. My name is eberechiayogu. Welcome to eberechiayogu Health Tune, a channel that teaches you about infectious agents and the diseases they cause. Thank you for subscribing to my YouTube channel. Thank you for watching my videos. If you have not subscribed and you come across this video, please do well to subscribe and watch my videos. You are helping me to grow, but most importantly, you are learning about your health. Thank you so much. Today, I want to talk about a virus, human papilloma virus infection. Human papilloma virus infection is caused by human papilloma virus. This virus is a DNA virus that is from the family of virus Papillomaviridae. So this virus is the most sexually transmitted disease, and at any point in time of our lives we may have one or two of this infection in our lives, though some are very complicated and causes cancer, but some can go on their own, just form warts and go on their own in 1 or 2 years. So this virus is divided into two: the one that causes complication, that's the one that causes cancer, and the one that does not cause cancer, that form only warts and go on their own. So for that reason, the one that does not cause cancer is called low risk HPV. The one that causes cancer is called high risk HPV. We may be infected with any of these. So when this one that causes cancer, where do we see them? We see them at some anatomical sites of our body, such as the cervix. When we see it in the cervix, it causes cervical cancer, what we call cervical cancer. It causes cervical cancer. When we see it on our vagina, it causes vaginal cancer, vulvar cancer. When we find it in our anus, it causes anal cancer. When it is on the penis, it causes penile cancer. There are so many cancers that this virus causes. And when we find it in our mouth, it is called head and neck cancer. That is when it causes the oropharyngeal cancer, nasopharyngeal cancer. It causes the mouth cancer, which is oral cancer. It can cause tonsil cancer. It can cause cancer around our mouth, and this is a very dangerous one. And we also know how dangerous cervical cancer can be to women, and even penile cancer to men. So it is a very serious one, and we'll do every possible thing to prevent it, because this virus has vaccine, and when you protect yourself early enough, you are not going to be infected with this dangerous virus. Any virus that causes cancer is a dangerous one and should be taken seriously, because we know the burden of cancer in the public health. So what are the transmission of this virus is through skin to skin. When you have an abrasion on your skin, a lesion or an injury on your skin, because this virus has affinity for epithelial cells, then your epithelial cells have been exposed through the injury, and the virus will enter through that injury into your body and start causing problems. So skin to skin is one of the transmission. Sexual intercourse is also another mode of transmission, whether it is anal sex, whether it is vaginal sex, or oral genital sex, any type of sex, or whatever that can give you abrasion in your private part, in your vagina or your penis. This virus can be transmitted through those lesion or abrasion. So oropharyngeal cancer can also be caused through oral sex. What are the symptoms? Firstly, let's talk about the genital cancer, genital HPV. So the virus will cause a bump-like something like a bump in your private parts, either in your anus, in your vagina, or your penis, or around your genital. It will cause a bump like a flower like something, like a cauliflower inside your vagina or your private parts. And this bump will be there for a very long time, because this infection does not show symptom immediately until it is almost or at the last stage of the cancer. That's when you start seeing symptoms. That is the reason why many people that have it, they will not know that they have it, and when they go to hospital because they are having one symptom, it is already late. So we are expected to know our status against this virus, because it is very much important. So common what we see it on our body, it is caused by the low risk HPV, and it does not cause much complication to us. We only see bumps on our body. We see bumps like, we see, it's not a rash, it's a bump, something that you just see growth on your body, and it can go on its own when it is the low risk benign wart, common wart. It will just go. You can see it on your hand, on your face, on your neck, any part of the body. But those ones, they don't cause cancer. You only know the one that is low risk and the one that is high risk when they do test for you. PCR can determine which one is high risk and which one is low risk. You cannot just be on your own and say, I am having a low risk HPV, because you are seeing one bump on your body. No, you have to go to hospital and get yourself diagnosed. That is it. So common wart is like a raised bump. It can go on its own. So that is it. What is the risk factor for this infection? The risk factor is having numerous sexual partner. Numerous sexual partner can expose you to this. Smoking is always a risk factor for cancer. So weaken the immune system. When your immune system is weak, it cannot fight the infection. When it enter your body, it will stay and start damaging things. Or damaged skin. When you have any damaged skin and the skin is in contact with, because some people, when they are having, especially people that are having anal sex, they will have abrasion on their body, and HPV can enter through it. So anal sex is also another risk factor. Or having other STI such as herpes virus that will open a wound on your body, it can also expose you to HPV. So personal contact with another people's warts, as in maybe you are in a bus, somebody has a wart, your body is scratching on the person's body. At the end of the day, you can get it if the person is having it. So try as much as possible to run away from all these risk factors. It is something you can control, and you may not be infected, because this is a very dangerous one. It's a very serious one. We have to take it very serious. This virus has a vaccine, and we are expected to be vaccinated. When you have a child of 9 to 15 years or more than self, you can go to hospital and get the person vaccinated. The reason why it is having time is because maybe after the age of 15, some people may be exposed to sex. So you have to go to hospital and get yourself diagnosed. If you are not already infected, you can get yourself vaccinated. It has a vaccine, and we can be prevented for it. Adults, especially people who are above 30, are expected to go for pap test, a test that is called pap test, every 3 years, to check yourself if you have been infected, because this virus does not have symptoms. So we have to check ourselves regularly to avoid being infected. So this is just a short note overview of human papilloma virus. I think I will do another one that will talk about maybe cervical cancer properly. So, and maybe I'll be taking it one by one, cervical, anal, and all of them. Thank you for watching my video. Thank you for subscribing. I am very much grateful. Thank you.